Good morning, and welcome to a beautiful day in Chapel Hill, and thank you for all of you who are here and who were here last night with us. I'm Barbara Reimer. I'm Dean of the Gilling School of Global Public Health, and I want to welcome you to Going Viral. The 1918 influenza pandemic that killed 50 to 100 million people around the world and over 14,000 in North Carolina, including President of the University, Edward Kidder Graham, and his successor, M.H. Stacy, both in their early 40s, was a defining event for the 20th century. Bookmarked between two eclipses, it happened quickly, first with relatively mild influenza in the spring of 1918, and then with a vengeance in the fall. The pandemic came while World War I was raging in Europe, and U.S. soldiers were mobilized on overcrowded bases in the U.S. and sent to Europe on tightly packed ships. Of course, in 1918, viruses were not understood, and the medications and folk remedies, some of which Paula Eckert showed us last night, on which people relied were useless. And into that midst came a virus so virulent that it could kill within hours, and resulting in really worldwide deaths and tragedy. Families were shattered and children were orphaned. And as many of us have now heard, in Look Homeward Angel, Thomas Wolfe, then a student at UNC Chapel Hill, described the agonizing death of his brother Ben from influenza. While still in Boston, our first dean, Milton Rosenau, did experiments to understand how influenza was spread. We would not do those kind of experiments today. Abernathy Hall on the campus, close to the Carolina Inn, was the infirmary during the epidemic, the place where over 400 students were hospitalized. Students who, in those days, were expected to belong to one of two campus societies that would pay for their burials if they died while students. It is said that the building is haunted. The pandemic set the stage for the growth of hospitals and health professional schools. 100 years later, we know much more, thanks in part to some of the people on the program and a relentless drive for knowledge that ensued. Our speakers and moderators are some of the most accomplished scholars in the world, and I am grateful to each of them for being with us. Historians, social scientists, and literary scholars will examine the history of the pandemic, and we'll hear tomorrow how the pandemic and the period of World War I affected Black soldiers and the legacy that remains. On the agenda are scientists who are discovering flu variants, understanding their transmissibility, and creating vaccines and antivirals. Speakers also describe the frightening potential to turn deadly flu viruses into destructive forces and what can be done to prevent that. We also consider how to communicate about flu and other infectious diseases. In 1918, the world was unprepared to fight an enemy that vanquished the young and healthy. But today, modern air travel could make a pandemic faster and more furious. I want to thank an amazing planning committee that included people from across campus and beyond to the Health Department, RTI International, and other partners. And an amazing group of people in the school who really were doggedly persistent in working on this. Co-sponsors really brought important skills and resources, and I want to thank RTI International and Wayne Holden, the CEO, Mike Cohen, who leads the Institute for Global Health and Infectious Diseases, and Emlyn Koster, who leads the North Carolina Museum of Natural Sciences, a wonderful partner. We also appreciate the help of the Smithsonian and the special posters they provided. We are indebted to the collaboration of UNC libraries, including Vice Provost Elaine Westbrook, Bob Anthony, Nandina Manny, and Dawn Lucas. And I want to thank Lynn Roundtree for starting this all with an email to me. Have you thought about the 1918 pandemic? It will be a fascinating day and a half, and we're going to start with welcomes from our wonderful Chancellor, Carol Folt, and the Honorable David Price, our Congressman. And after that, we'll move to the first session led by Professor Allison Aiello from the Gillings School. And we're going to be relentless in staying on time because we have wonderful speakers. So it is my pleasure to welcome our wonderful Chancellor, Carol Folt, a distinguished scientist who well understands the enormity of the events that we will discuss, and she will be followed immediately by Representative Price. Thank you all for being here.
Good morning, everyone. Thank you, Dean Reimer. When she first told me about this event, I said, oh, I want to be able to stay for the entire event. I mean, it is really an incredible set of speakers and conversations going on. So it's a real pleasure on behalf of the University of North Carolina to welcome you to this amazing interdisciplinary symposium, of course, focusing on the implications of the 1918 flu pandemic. As I was getting ready to come in this morning, of course, I was listening to NPR, and it was being discussed on NPR, and our own historian, Jim Leludis, was being interviewed and talking about how something that happened then happened in part because we didn't have public health services. We didn't have schools of public health. We had not really begun any of the work that is so important and takes place in such a wonderful way, not only here at this university, but in our region with its influence across the globe. I want to extend my thanks also along with Barbara to beginning with the Gillings School of Global Public Health for hosting it, and our wonderful co-sponsors, the Institute of Global Health and Infectious Disease, RTI, the UNC Library, and a special partnership with the Smithsonian. Of course, this represents the modern university, interdisciplinary, very collaborative, and a place where people come together to solve complex problems that are not the purview of any single silo or any single discipline. I, too, want to thank all the speakers for coming and participating in this event, and I know that it's going to be something that helps us not think simply, not that it's simple, about the history, but really about the implications of it all the way to today and to tomorrow. It was envisioned by an interdisciplinary dream team, and I think that's something that our Gillings Global School of Public Health is quite renowned for having. You know, they bring people together from all areas to really address these problems. And I want to thank the committee and the faculty and staff from public health, medicine, English, history, the libraries. That's the way things are done here, and it's a pleasure to see it. You know, looking back to 1918, of course, I learned a lot about it from Barbara, and I won't repeat what she said, but she reminded me that University Day in 1918 was in October, and there are pictures in the UNC Southern Historical Collection showing then UNC President Edward Kidder Graham in the procession for University Day on October 12, 1918. At the same time, he was writing letters to parents reporting that the influenza incidence was receding at UNC. And of course, quite tragically, right after that, just 2 weeks after University Day, President Graham had passed away, a victim of the pandemic. And then university interim president Marvin Stacy, who at the time had been the dean of faculty, died just a few months later in January. Of course, they were both in their 40s, and as you heard, this pandemic affected so many people across the state with legacies of that loss extending into today. It's interesting when you think about history, some people say, well, why do you talk about it? Well, you talk about it because what you learn, and then I think also the footprint that it leaves on everything that we do today. And so again, I applaud everyone for taking that approach, realizing that we've seen such an evolution in thinking and research that in some ways was actually built upon what had happened in that pandemic in 1918. Just 100 years ago, the physicians could only treat the clinical disease. They didn't think about populations and how it worked on devastating communities. Yet it made a very significant impact, and the impact was not equal. Some places had mortality over 10%. That was decimating. And so, of course, I'm talking to people that understand that very well, but having a chance just to remember that I'm a scientist, too. As I talk to all of you, it's great. It's really a pleasure to be here. And I think now when we look at what happens in a university and how important that is for the nation and the world, you know, one area it's really important are these virulent diseases that also spring up into prominence. I'm reminded that just a few years ago, I'd never heard of Zika. And I was reading about it in a newspaper in Boston, started reading about Zika, and I said, I gotta call Mike Cohen. What is Zika? And of course, I found out that we had people here working on it. And universities having that kind of long-term investment, you don't know when it's going to be necessary, but the fact that there were already people that had some knowledge of that made such a difference on whether the world could even begin to address these sorts of infectious diseases. And we have people here working on Zika, dengue, Ebola, SARS, MERS, all the latest strains of influenza. And that long-term investment in their research over time is what is so vital to keeping our nation healthy and able to react. And so that leads me very easily into my honor today, which is to introduce one of our illustrious alums, Congressman David Price, who's the representative from the 4th District. And the reason I say that's so important is that, you know, he's been in Congress for more than 30 years. You could not find a better champion for the importance of research, long-term research, health-related research. He's been a champion for international studies. I mean, these are all parts of what make not only this university great, but this region so important in the world. He's helped us in so many ways. He helps the people of the region and the universities, and he always is a welcome guest and a participant in events like this. So it's my pleasure to introduce Congressman David Price. Thank you.
Thank you, Chancellor, and good morning, everyone. This is a familiar scene, the Friday Center with illustrious guests and presenters from all over the state, all over the world, gathering for conferences, often on biomedical-related topics. But this one is really distinctive with its historical focus and also the relevance to challenges, public policy challenges we face in our country today. So I'm especially glad to welcome you. You've been welcomed already. You're also in the 4th Congressional District, just realize that. So, so welcome to our Congressional District and to our state and to, of course, our wonderful state university. And Chancellor, thank you for those words. And she does speak with authority, both as the leader of this institution, but also as a scientist of distinction in her own right. So we're happy to get you started here, and we won't delay long in doing that. But you're kind to invite us to kick this off, and it really does look like an interesting conference in store. A lot of people went into sponsoring this event and making it happen, and we do appreciate the way those pieces regularly fall together to enable collaboration and to enable conferences and good work, promoting your work in ways that will benefit you going forward. Conferences serve that function, and a lot of people have had a role in putting this one together. Public health preparedness, emergency response, of course, is a major focus as we look at the past, look at history, look at what has changed, what maybe hasn't changed enough, and think about how ready we are and will be for the pandemics, the emergencies that we know are coming in our future. It is an important function of the federal government to be a partner in these efforts, to coordinate these efforts. I was just checking the number of federal departments involved in one way or another in public health and emergency response. The lead agencies, of course, Health and Human Services and Homeland Security, but some piece of this is held by an array of other agencies: Veterans Affairs, Defense, Agriculture, Interior, Energy, Transportation, all have roles to play during an emergency or a health pandemic, of course, a naturally occurring pandemic or an artificially induced event of some sort in the era of terrorism. From conducting routine surveillance to conducting vaccination policy to planning interventions, the federal government is a critical player and, of course, is well represented here in this conference, as it should be. The House and the Senate, our Congress, are also critical players, particularly the appropriators therein. And that's something that, in positive and negative ways, also enters into these discussions and into this history that we are going to be looking at. I am fortunate, I suppose, to be speaking to you as an omnibus appropriations bill for the current fiscal year has just been passed. And it was only 5 months late, after all, so I would expect you to celebrate that. Actually, I don't celebrate the lateness at all. I think it's probably a pretty good example of Churchill's dictum that often in democracies we try everything else and then finally do the right thing. That's really the way budget policy feels these days and has felt ever since the landmark election of 2010 put the Budget Control Act in place, and we're doomed to live with that for 4 more years. So we go through this budget drama, and we try everything else, and then finally do a bipartisan agreement, leave the more extreme elements aside, and write our appropriations bills. Well, that's not a good way to govern, but it does beat the alternatives at the end of the day. We do have, I think, in this omnibus bill just approved, a fairly robust level of funding for many of the functions that you're concerned about and that you're going to be talking about. That's not to say that we have adequate appropriations in place or that we can count on that in the future. We have to keep making the case. And we have to make the case, I think, not just for robust funding, but for predictable and steady funding that we can count on so that planning can occur and so that we're not always scrambling. So I'm well aware of that and concerned about it. And I think as you communicate with representatives, whoever you're dealing with, I think it's important to communicate that need for predictability and a reliable source of funding for these critical functions. I want to just refer to a couple, and then I will sit down and the conference can proceed. But I do think the focus on the 1918 epidemic and the historical reference, that's unusual. I think it's interesting and arresting, and I'm glad you're doing that. And then you're also going to be hearing from people who are currently involved in some rather specialized elements of this effort, and that's one that this university has taken a special role in, and that is the integration of key data, key information about health and disease events, and ensure that our responses are well informed and as effective and efficient as possible. The National Biosurveillance Integration Center at the Department of Homeland Security is an agency that's come a long way and that we need to support and promote and develop in the future. And the University of North Carolina at Chapel Hill has had a particular role in delivering that function and helping us chart the way to the future. I'm referring to NBIC, and I'm referring to the National Collaborative for Biopreparedness, which we call NC Be Prepared. It's a public-private partnership. You'll hear more about it later from Mark Holmes, the director of the Shepp Center for Health Services Research here on campus. But it started with an initiative from the North Carolina Department of Public Health and Leah Devlin and other pioneers who saw the possibility here. And then, of course, after 9/11, it took a much more urgent. It became a matter of more urgency and also, of course, much greater, more ambitious plans. So the staff there analyzed data on human health, animals, food and water systems, and the environment. The idea is to provide an early warning system that alerts officials of detected biothreats. So that is a critical contribution that this university is making, and that I'm well aware the Congress needs to support through the Homeland Security Department. So I just commend your attention to that later in the day. We also, of course, need to attend to global health. Epidemics, pandemics don't respect national boundaries. So our country has a stake in global health as well as, of course, as a humanitarian interest in reaching out to some of the world's most destitute places to promote just the very basics of health. And so we fight on that front as well. And our budgets, often the budgets we're receiving these days, are grossly inadequate in that respect, and so we have to change them. And in this omnibus bill, what's reflected is a bipartisan willingness to change those administration budgets and to take a fresh start and to continue these global health efforts, as well as a lot of the work of the CDC and the research budgets here at home. So constant attention to this is required, constant vigilance. I know that you're not used to lobbying and advocating maybe as directly as some others might be, but increasingly we need to attend to the way our federal government is functioning and the kind of appreciation that the public has for things that are critically important, but might fall by the wayside if we don't tell our own story. Don't assume your good works speak for themselves. That's a pretty good maxim in this business, and so a conference like this, of course, helps raise awareness all around. But I do think don't ever underestimate the importance of what you're doing nationally and internationally, how critical it is to our national interest, and how the policymakers of this country need to know about it, need to deal with it, need to attend to it. Don't let that be optional. Bring forth the kind of needs that you perceive, and let us know about the work you're doing. And we have a solemn responsibility, I believe, to take this into account as we conduct the nation's business. So that's really the reason I welcome the chance to talk with you today, not just to welcome you to North Carolina, but also to welcome you to the fray as we stand up for things you know especially about, but things that are important, vitally important to our country and to our world. Thank you for what you're doing, and let's let the whole world hear about it. Thank you.